So tonight is the last or the 6th session in our 6-part series on feeding and nutrition. Hopefully you've enjoyed them. Hopefully you've gotten valuable information out of the sessions, and hopefully they've kind of made sense, the topics and the order in which we've presented them. The purpose of tonight's is to talk about some of the things that can go wrong that are directly affected by nutrition or our feeding practices. There's a lot of stuff that we're not going to cover that nutrition indirectly affects. I'll give you an example, mastitis. It's not a nutritional problem. I mean, not a nutritional disease. It's usually bacterial. But how we feed females, like when we're drying them off, can have an effect. So there's a lot of other things that nutrition has an indirect effect on, but tonight we're going to talk about the disorders or diseases where the effect is more direct. I mean, that it really is caused by nutrition or feed management. And I'm going to talk about the diseases I have listed here. I'm going to do them in alphabetical order. I forgot to list, when I talk about copper toxicity, I also want to talk about copper deficiency, so I don't have that listed. When I talk about white muscle disease, I also want to talk a little bit about selenium deficiency in general. But otherwise, we're going to talk about these 11 diseases, and we're going to look at the factors on the right, what other names they might have, because a lot of times the diseases have different names, and if you see a fact sheet or look it up on the internet, it might use a different name, particularly if it's in another country. I've always got a kick out of some of the names Great Britain uses for diseases. We're going to look at the causes, what the diseases are and what causes them. What are the risk factors? You know, what is it that's either happening or that we did that makes the animals potentially get these diseases? What are the clinical signs? You know, what are we going to see if these animals are experiencing these problems? What are potential treatments? And ultimately, how do we prevent these problems from occurring? Because as everything in health, whether it's human health or animal health, the whole key is to try to prevent these problems from happening. We may not be able to prevent every case in every year in every situation, but we want to do the best we can to mostly be in the preventative mode, but at the same time be prepared in case we need to treat an animal. I'm going to use some abbreviations throughout this presentation, and this basically just tells you what they mean. I used to work for a veterinarian, and we used a lot of abbreviations, and there's a whole long list of them, but just to give you an idea of some of the ones I'm going to use tonight, just to keep the letters to a minimum on the PowerPoint. TX means a treatment. VX means a veterinarian. This is where you involve a veterinarian. RX means a prescription drug. You cannot buy it over the counter. Some cases you can buy stuff over the counter, but they're still supposed to be prescriptions. Some you can only buy via prescription. Perfect example is Bosi or selenium vitamin E. You can't buy that over the counter. That is a veterinary prescription drug. OTC means over the counter, means anyone can buy it. Intramuscular injection, that's IM. Just a couple of where the injection or product should be given. Sub-Q is subcutaneous, and IV is intravenous. And these are important because when an animal is in a more severe situation with the disease, oftentimes the drug needs to be delivered IV in the vein so it gets in quicker. And that may be a situation that you can handle, or it may be a situation where you bring in a veterinarian. It just depends. Okay, we're going to start with A, and we're going to start with acidosis. Acidosis has a lot of different names. You can see them all listed on this slide. The one that's quite different is grain founder. Founder is more common with horses, but kind of an acute acidosis can affect the hoof health of livestock. So acidosis is kind of like what it sounds like. We have large quantities of gas or acid in the rumen. We get a change, and that little triangle means change, in the ratio of those volatile fatty acids. If you remember that from the first session, we have the butyric, the acetic, and the propionic. Acidosis, we've got a different ratio. We've got a changing ratio. We produce more lactic acid in the rumen, which is where we come up with the name lactic acidosis. The rumen pH goes down, so we're making that rumen more acidic. And as we do that, not only we changing the volatile fatty acids, but remember the different microbes operate in different rumen environments. So what happens to the animal is the pressure builds up, they're unable to expel that gas, and it can lead to their death. It can be life-threatening. Acidosis occurs primarily when they get a sudden intake of readily digestible carbohydrates, highly fermentable carbohydrates, starch. This is usually grain or pellets or byproduct feeds. And they get this sudden intake one of several ways. One, we didn't give the rumen an adequate adjustment period. We got to do things gradual. We got to give that rumen time to adjust. We got to give those microbes time to adjust. Sometimes they accidentally gain access to feed. When I first put my grain bin in, I did not put a screw in it, so they actually opened it once or twice. You'd think I'd learned after the first time, and then they gorged themselves on grain. The other way they can all of a sudden eat too much is their intake varied. Not purposely, but maybe the change in weather, that they didn't eat as much, or some things that can change how much they eat. You just look at creep feed, for example. On a rainy day, lambs are going to eat more creep feed if it's inside. So weather can change their intake. And then to a lesser extent, but still important, is the lack of roughage in the diet. These are ruminants and they should have roughage. And by roughage, what I normally mean is a long stem forage, a long forage. So what kind of things are you going to see if an animal has acidosis? A lot of it's pretty generic in terms of just looking like an animal that's kind of experiencing a gastrointestinal distress. He's not going to want to eat. He's going to be depressed. He'll appear to be in pain. The slide changed the graphic where it says slow down to cease. That was actually supposed to be an arrow and not an upside down A. But the rumen contractions are going to start to slow down. They will eventually stop. They may have diarrhea, and it may be mild at the beginning, and as it progresses it can get very bad. Left untreated, eventually they'll become recumbent, meaning they'll go down, they won't get up, and they can die. These can happen very rapidly. Death can be very rapid. It's important to note, while acidosis is primarily caused by a grain or concentrate diet, always keep in mind that these things can still occur on pasture. They may be more likely when they have a sudden intake of highly fermentable carbohydrates, but we can also have a pasture where the dynamics of that pasture is they've also got a really high quality, easily digestible feed. I mentioned laminitis, which is basically an inflammation of the hoof. It's not real common in sheep and goats, but it can occur with what I would call an acute acidosis, something that you don't even notice the signs. They don't have these signs on the left. They're not going to die, but it's kind of a low-level acidosis. And that may occur in a lot of situations that we don't even know about. Maybe not laminitis, but overall they have a low level of acidosis because of the diet they're consuming. So if you discover an animal that you believe has acidosis, and I can honestly tell you, you're not going to look at these symptoms and know it's acidosis necessarily. You're going to combine what you see with the history. Like when I knew my sheep got into my grain bin, I expected to see those kinds of symptoms. So it wasn't just saying, well, I saw those symptoms because they were relatively generic, but I matched it with what had occurred. So the treatment, assuming you get to them quick enough, is to neutralize the acid. If it's early enough, it's just a matter of removing them from that grain diet and feeding them hay. And then once you got their system back on track, then you could gradually reintroduce and gradually increase the concentrate or whatever it is that may have caused that acidosis. So if you catch them early enough, you just change the diet. If they're already suffering some of the symptoms in a more severe way that were on the last slide, We usually drench them with things, again, that neutralize the acid. Sodium bicarbonate, which is basically baking soda, oils like vegetable oil, mineral oil, and antacids. You know, you can buy them for livestock, or you can use some of the standard over-the-counter remedies. When an animal is far more severely affected, and this is going to be true with just about every disease we talk about tonight, if you don't catch them early enough, and if you aren't able to accomplish kind of the initial goal of treatment, a lot of time that animal just needs a lot more general medical care, more what I would call emergency medical care, whether that's an anti-inflammatory drug or whether that's antibiotics or electrolytes and fluid therapy. You know, the more extreme cases, to keep them alive, may need that. The way we prevent it is simply to make sure we change diets gradually. If we're going to feed grain and pellets or byproducts, and there's not a thing wrong with feeding them, but we need to give the rumen time to adjust. When I start feeding my ewes in late pregnancy, I start out with 1/4 pound. And I take several weeks to gradually increase that ration. The other thing that can help is not to crack or grind the grains. Now, if you buy a pelleted one or a textured feed out of a bag, you know, you have no say in the matter. But if you're feeding whole, if you're buying a grain, a corn or barley, it's best not to crack them or grind them, because when you do that, they go through the system quicker. You're more likely to get acidosis. Really, you should never grind or crack feed for sheep or goats other than the little babies whose rumens aren't yet functioning. They're less likely to have any digestive problems if they have to do their own grinding. There are various things we can add to feed if your situation is high risk. I'm going to mention ionophores on many of these slides. By ionophores, I mean Bovatec, which is Lasalicid is the drug, and Rumensin, which is Monensin. They are approved as coccidiostats for sheep and goats in the U.S., but ionophores have many, many positive aspects. They change in a positive way the volatile fatty acids, and they help to prevent things like acidosis and bloat. I can really think of no negatives to feeding ionophores, other than obviously there's going to be a cost associated with them. We can feed buffers, and the example of that would be baking soda. That's going to help keep the rumen from getting too acidic. A lot of goat people do that, and I know one time we had a 4-H project where we had a bunch of kids, a bunch of goats, and we had a bunch of kids involved and a bunch of kids feeding them, and kind of to prevent against some feeding errors, we went ahead and fed baking soda. Yeast is another product, and there are other products that affect the rumen that can be fed. I'm not saying most producers would need to do this, but we're going to go over things that can help prevent these problems if they're a problem in your flock or herd. The next disease is bloat. Bloat has a lot of similarities with acidosis in that somewhat of the same thing is occurring. We got excess gas in the rumen, and we've got a failure. They're unable to expel that gas, carbon dioxide or methane, and the same thing, the pressure builds up, and it can cause death. We have two different kinds of bloat, though. We have what we call a frothy or foamy bloat, and we often call that pasture bloat. So we associate acidosis primarily with concentrates. We actually associate bloat commonly with pasture. But there is also a free gas bloat, which doesn't have a froth or a foam associated with it, and that can occur in the feedlot. It's not all that different looking or even to be treated than acidosis, because we've got some similar things going on there. So the risk factors to have bloat on pasture is having pastures that have more than 50% legume. By that I would mean alfalfa, red or white clover. We do have some legumes that don't promote bloat. Lespedeza is an example, and bird's foot trefoil is an example. If you have 10%, 20, 30% alfalfa in a pasture, it's not that they could never get bloat, because they can get bloat on grass pastures, but your risk is considerably lower. It's these pastures that are very high in legumes. In most cases, we don't want to graze pure legumes. I know people have successfully done it, but we've also got problems with estrogens in terms of fertility and breeding on those pastures. So most pastures should have a combination of grasses and legume, or grass and legume, but not an excessive amount of legume. We can get bloat on small grain pastures, wheat and rye, pastures, those early spring pastures that are lush and wet and succulent. I actually get bloat every year when my ewes first start grazing in the spring. I mean, they're out all year, but when the grass first starts coming up, I try to restrict them, but I'll get these very mild cases of bloat when they're on that fresh, wet, succulent pasture. From the feedlot side of it, again, it's very similar to acidosis. It's that excessive consumption of highly fermentable grain pellets or byproduct feeds. The clinical signs of bloat are a lot easier in that you'll see a distended abdomen on the left side of the animal. I couldn't find a picture of a sheep, and I've never taken a picture of one of mine, but you can see this calf clearly is bigger on the left side, and that's kind of a telltale that they've got bloat. Otherwise, the symptoms are quite similar to acidosis and also quite similar to various other metabolic and non-metabolic problems. Much like acidosis, left untreated, those symptoms will progress, eventually leading to the death of the animal. And sometimes the only symptom you have is like the one in the picture, dead. Now, one thing I will say is, just because an animal looks bloated when you find it and it's dead, it doesn't always mean it was bloat, because generally speaking, when they die, they also kind of have that bloated appearance. So if it looks bloated and you find it on pasture, it's not necessarily dying as a result of bloat. Maybe, but not necessarily. So again, the treatment's going to be somewhat similar to acidosis, although I would say in some cases it's a more serious condition. If it's fairly mild, and again I'm going to say my ewes, when they experience this in the early spring, it's very mild, they may or may not even stop eating. I can just see that distended left side. The first simple thing you can do is massage the stomach, try to encourage them to belch, get them walking around. And then just like acidosis, we can drench them with things like vegetable oil, baking soda, corn oil, and antacid, a commercial anti-bloat medicine. In fact, some type of medication that's going to break down that foam is essential for the frothy bloat. Because the next step would be actually, not yet, but you can also pass the stomach tube down through there to try to relieve the gas. But in the case of the frothy bloat, you really got to have something to break down that froth. The free gas bloat's a little bit different. Under a life and death situation, and you guys have probably heard of this before, you can actually puncture a hole in the rumen to try to relieve that pressure. I know producers who've used a knife, but really for a sheep and goat you really ought to use a needle. I can honestly say I have never performed this. I've never had an animal that required it. I put down that you should have a veterinarian do it. I think that's the case with many people. I certainly think there are producers that are experienced enough that they could attempt this on their own. And but that is kind of, you would do this in a life or death situation. Since this is primarily a pasture problem, the prevention is kind of more on the pasture side, obviously. And there's lots of different management things that you can do. Certainly you can restrict pasture intake, particularly as they're changing to, like in my case, they're changing to a more lush feed when that spring pasture starts to grow, or maybe you turn them into a small grain pasture. You can restrict how much grazing they can do. You can fill them with dry hay before they go out onto that pasture, because when they have a really succulent, palatable pasture, they're going to eat and eat and eat, and sometimes we got to force it so they can't do that. So just like taking them from a predominantly forage diet to a predominantly grain diet, we also need to make gradual changes when the forage diet is significantly different. And going from hay to a succulent pasture is significantly different. Going from a poor quality mature pasture to one that you've been saving, again, those are significant different changes. Maybe not as severe as grain and forage, but there's still significant changes. Again, there's feed additives that can help with that. There are anti-bloat medications primarily used in the cattle industry. Again, the ionophores help prevent bloat. If you've got animals on pasture, you could provide those through the mineral. If you've got animals on feed, obviously we can provide ionophores in the feed. Again, ionophores are really a win-win situation, in my opinion. My only concern with ionophores would be the possibility that year-round use could render them resistant to coccidia prevention, which is still the primary need that the sheep and goat industry has, is to use these products to prevent outbreaks of coccidiosis. So I would have some concern if we use them for a long period of time. They change kind of the chemistry in the rumen, and they change the ratio of the volatile fatty acids. One of the reasons they help with performance, particularly in the cattle industry, is because they increase the amount of propionic acid. And if you'll remember from our first session, while acetic acid is kind of the one responsible for milk fat synthesis, we get more efficient glucose production. It's the only one that can make glucose when there's more propionic acid. Decox is not an ionophore. It's a, and I'm trying to think, I can't pronounce the actual class that it is. I don't know that you would achieve the same thing. I don't know, or I don't know for sure, but it's not an ionophore. Okay, the next thing we're going to talk about is one that I think is one of the most important metabolic diseases or disorders, and that relates to copper. Decox is a coccidiostat, but it also has a drug name that I can't think of. So copper toxicity. The one thing I want to say about copper, whether it's toxicity or deficiency, is that it is an incredibly, copper nutrition is very complicated. Nutrition in general is very complicated, but copper is complicated because it involves several other minerals. I've tried to make a little graphic here. It didn't quite format correctly, but I've got copper in orange, and you'll notice that we have in MO is molybdenum, S is sulfur, and Fe is iron. Molybdenum and sulfur will both bind with copper, forming an insoluble complex which prohibits the animal from absorbing copper. Iron also affects the absorption of copper, and there's also other minerals that can. So when we talk about copper, we're not just talking about copper. We actually have to talk about a lot of other minerals. So what copper toxicity is, it's basically excess copper is stored in the liver. And we reach a point where the capacity of the liver to handle that copper is exceeded. We can have chronic or acute copper toxicity. Acute, which is less common, would be when the animal all of a sudden consumed a lot of copper. Chronic is what's more common, where that copper builds up over time. It may take a long time, but it builds up over time. But it reaches a point, and it's usually triggered by stress, where that it has basically a hemolytic crisis, and we start destroying red blood cells, and we cause liver damage that's released into the bloodstream. Unfortunately, I had several real-life experiences with copper toxicity in sheep, long time ago when I was a kid, but we had 2 outbreaks 5 years apart. And, you know, and it's something you don't want to have. What's hard about copper, again, because of the interaction of the other minerals, is no one can tell you what level of copper in your grain ration or whatever is toxic. Even the new NRC requirements will not put toxic levels in there, because what's toxic depends on the levels of these other minerals, particularly molybdenum. So if there's a lot of molybdenum, then you can have more copper, and vice versa. So it depends on the interaction of all of these minerals. And the risk factors for copper toxicity are many. The first thing is just looking at the animals themselves. Certainly it's a much greater risk in sheep. Goats are far more tolerant of copper. They need more copper. Sheep are the species that is the most susceptible to copper toxicity. They have a very narrow range between what they need and what is toxic. Within the sheep species, we see differences in breeds. The ones that seem to be the most susceptible are a lot of the British or down breeds. A down breed would be something like Suffolk, Hampshire, Southdown, our medium wool breeds, and our dairy sheep. I've got a picture here of the Texel. This is the breed that's considered to be the most susceptible to copper toxicity. Thin sheep are probably the least susceptible to copper toxicity. We've got a lot of sheep breeds. I don't know if we know about every single one of them. Some people wonder if hair sheep are more tolerant. We don't know. But we do know in general some of the differences I just stated. We see differences in the age of the animal. Young animals absorb copper much more efficiently than an older animal. In other words, you're far more likely to have a copper toxicity issue with a young animal. When my family experienced it, they were all lambs. They were all lambs. And generally speaking, copper absorption is very inefficient, but the young animal does a much more efficient job. So we've got differences based on animals. And when we talk about copper toxicity, we really are focusing more on the sheep. Still can occur in goats, particularly if we meet some of these other risk factors. Simply there's too much copper in the diet. In the case of a sheep producer, that could be feeding minerals or feeds that are formulated for other livestock. If you have sheep, you should not feed horse feed. You should not feed goat feed. You should feed sheep feed. You should use sheep minerals. Sometimes we do the right thing and there's errors in how the feed is made. That can happen. Certainly, it's not a good idea to add more copper to the feed or to the mineral. All of those are risk factors. And then again, I look at the other minerals. We've got what we call the copper antagonists, those that affect the absorption of copper. You know, if you have low levels of copper, low levels of molybdenum, you're going to have less molybdenum to bond with the copper, so more of that copper is going to be absorbed by the animal, and a lower level of copper is going to cause toxicity. Other risk factors, just the chemistry or fertility of your soil, whether it's acidic. We had a situation in Maryland, one of the a research farm, NIH or something, was having copper toxicity issues. They had no supplemental source of copper in terms of the feed, and it ended up being a soil fertility issue. Copper sulfate foot baths. Don't recommend that you use those. If the sheep drinks them, that's going to put them at risk for copper toxicity. Don't recommend that you deworm with copper. You may read a lot about research is being done with copper wire, copper sulfate. Using those products is going to put you at an increased risk for toxicity, particularly over time. If you used a copper product to deworm over time, because that's where the copper accumulates, you may have a problem. Copper plumbing. When I was a kid, one of our risk factors ended up being our copper plumbing. And so that increased the amount of copper in their diet. Unfortunately, I've seen these symptoms in sheep. I've seen these symptoms, and it's not a pleasure. It's no fun to watch a sheep die from copper toxicity. While the copper accumulates over time, the symptoms appear rather suddenly. And the first thing may be just a weakness. They do a lot of teeth grinding, maybe not every animal, but I certainly remember a lot of teeth grinding. They're very thirsty. They drink a lot of water. The urine is like a blood red color, like you see in that picture on the bottom right. That's what their urine looks like. And the first time you see it, you wonder whether it's urine or a very liquid diarrhea. Their membranes will turn yellow. You can see in the picture up here. Same thing when you cut them open. I've seen the necropsies where they've cut them open and you see a lot of yellowing. They're going to get anemic. And then eventually they're going to develop the things that cause death. Difficulty breathing, they're going to go down, and they're going to die. And while the symptoms come suddenly, I can tell you they don't always die quickly. Sometimes it takes a lot longer than you wish it would happen. The treatment for copper toxicity, if you recognize it, is to inactivate that copper. And that gets back to those copper antagonists, molybdenum and sulfur. So the treatments is ammonium molybdenate. I always have trouble saying anything with molybdenum in it. And ammonium sulfate. You can't buy those at a local farm store or a company that sells supplies for sheep and goats. It's more like buying them from a chemist. The other drug, curcumine, never heard of it, but is a people drug, but apparently would have a much quicker effect. We did successfully treat animals with these products years ago, but again, you're just inactivating that copper. You need something to bind with it. In terms of prevention, and here we're talking primarily for those of you raising sheep, again, don't add copper to your ration, don't add copper to your mineral, don't feed minerals or feeds that have been formulated for other species, particularly hogs and chickens. Don't deworm with copper sulfate or copper oxide wire. Somebody mentioned, actually I guess it was directed to me, but don't fertilize your pastures or hay fields with swine or poultry manure. The reason for that is the diets of swine and poultry are much higher in copper. And while the amount of copper in poultry manure varies from one to another, generally speaking, they're very high in copper. Don't use copper sulfate foot baths. Of course, there's other reasons not to use those either. Zinc sulfate is the drug of choice for foot rot. And then if you suspect that you might have a copper toxicity problem, you really need to investigate and look at things like feeds, forages, and soils for the different levels that you have of copper, molybdenum, and sulfur. And this is going to be true too if you think you have the opposite problem, which is copper deficiency, which is what we're going to talk about next. I don't think co-grazing chickens with sheep would be problematic in terms of the copper, because I don't think they'd create a significant amount of manure on the field unless you were going to put 1,000 chickens on a field with 2 sheep. But you would want to make sure that the sheep didn't gain access to the chicken feed. Copper deficiency is certainly a possibility. I'm going to say particularly with goats, but it also can occur with sheep. I found this map on the web. It tells basically the copper concentration in legumes in the United States, where and it gives the different copper levels. And you can see basically there seems to be an area in Missouri where they have higher amounts of copper. So I don't know exactly how useful the map is, but that gives you a general idea of it. Because we do have parts of the country, parts of the world where the soils are deficient in copper. Therefore, the amount of copper in the plants is going to be lower. And then if the copper levels are normal, but there's excessive molybdenum or sulfur, again, those are going to bind with copper and prevent the absorption, and therefore you could get deficiency. If you think you have a copper deficiency, you need to do some testing. You can look at livers, you can look at blood, you can look at pasture. It's a problem or potential problem that would need to be investigated. The clinical signs of a copper deficiency, some of them are very generic, but some of them are somewhat specific, particularly on sheep. But this idea of sway back, basically where you'd have a extreme weakness in the back, particularly in the young animals, is kind of a telltale symptom of copper toxicity. The other thing that's kind of a telltale sign of copper toxicity in like older animals, particularly in sheep, is, and it's not that easy to tell from the picture in the upper right, but we get what we call steely wool, where that wool lacks the crimp that's characteristic of it. And there's also indication that a copper deficiency can cause a loss of the color pigmentation in the wool. And in the case of the goats, there's a picture of basically hair loss in a goat, and so that would be the kind of the corresponding symptom. Unfortunately or fortunately, hair loss has a lot of different causes. And then as you look at some of the other symptoms, they're really, really generic. Because I often wonder when we feed goats sheep products, either because that's what's available or we also have sheep. Sometimes I wonder if any of them are experiencing these other problems like performance and reproductive issues, but we can't readily identify them because they're so generic. Because a lot of problems are obvious. You have the clear-cut symptoms, but a lot of them are really generic, and the only way we'd be able to figure out a copper deficiency issue would be to do some investigated kind of thing and some testing. If a copper deficiency is identified or suspected, there are things that we can do. Basically, treatment and prevention are quite similar. There are different products we can do to supplement copper. We can give copper injections. What's more common would be to drench with a product like copper sulfate, or to use those copper oxide wire particles. This is a picture of a product where the boluses are large, they're for cattle, they're to provide a copper supplement. What we would do for goats is we would repackage those large boluses. They have these little wires in them, and we'd repackage them into a smaller capsule, and then we would dose the goat with them, and then we could provide supplemental copper. We also can use these copper oxide wire particles to treat barber pole worm infection, and so this product has a couple of potential uses. I'm not saying that it should never be used with sheep, but again, we have to be far more cautious with sheep, and we need to look at the whole situation before we add any source of copper to sheep. To prevent it, again, it's about making sure we have the proper amounts of these minerals. Usually we take it for granted. We feed a feed, we feed hay, and we feed a mineral, and we take it for granted that we've got the proper levels. And in 99 cases out of 100, that's probably true. But if you add something or something about your situation is unique, that's when we can start getting into problems. If you commingle sheep or goats, or even if you're just a goat producer, always feed a goat product. Goat products are going to have more copper in them, and the goat needs more copper, tolerates more copper. If your forages and your soils are deficient in copper, you can fertilize. You can use a fertilizer that has copper oxide in it, so there are ways. And again, you can use some of the same products to both treat as well as supplement copper. To know specifically how much of what to give or how often, that's something that would, we got to. I'm not sure that information is readily available. We'd want to work with a nutritionist, particularly someone very knowledgeable about mineral nutrition. The next disease is Entertoxemia, which we commonly call overeating disease. There's basically two types. Actually, there's 5 types, but we're primarily focused on 2 types, C and D, with D being the classic overeating disease. And what's happening in this disease, they are clostridial bacteria. They are present wherever sheep and goats are. They're in the gut, they're in the manure, and adults have them in their system and are largely immune to them. But what happens is those bacteria will proliferate, and they will produce an endotoxin. And that toxin will be released into the bloodstream, and it'll cause the intestines to inflame, and it'll swell the lungs and kidneys. In fact, they call it pulpy kidney disease because of what the kidneys look like. It's primarily a disease of young animals shortly after birth through the feeding period. The shortly after birth is more likely to be the type C, and as they continue in their feeding period, it's more likely to be the type D. Risk factors: kills the best ones you have. The ones that are growing the fastest, the ones that are the most vigorous, the singles maybe, that's who it tends to affect, the ones that are doing the best. Because similar to some of our other diseases, what causes that bacteria to proliferate and produce that toxin is a sudden intake of large quantities of highly fermentable starches, grain, pellets, or byproduct feeds, caused by the same kind of 3 factors: accidental, inadequate adjustment period, or variation in intake. Again, think of that rainy day. Sunny day, they didn't eat much creep. Rainy day or rainy couple of days, all of a sudden they ate more creep. Or you let it run out and then you put more in. So you can get a variation. We can also get it on pasture. Milk consumption can also cause it. Like say all of a sudden the litter mate died, and so that remaining lamb or kid all of a sudden has access to a lot more milk. It's not caused by inadequate roughage intake, but that's another contributing factor. Ruminants should always have roughage in their diet, and that will help as one of the preventative factors for a lot of these diseases. The clinical signs is mostly the picture on the lower right corner, just dead, just dead. And again, often the best, most vigorous lambs and kids that you have. The picture on the right, I actually have no clue what that lamb died of, but it looked like, just a good picture to put in there. The symptoms are somewhat generic. Again, I'm not hungry, I don't feel good, I'm lethargic, I'm colicky. We will see some nervous system signs, which we don't typically see in, say, the acidosis and the bloat so much. They're clearly in discomfort, diarrhea, things like that, but somewhat generic. And most commonly, I think, again, they're just sudden deaths. If you are able to diagnose enterotoxemia in your flock, or in an individual, the first thing you do is you give them the anti-serum or the antitoxin. Unlike a toxin, which takes time to develop immunity and requires a second injection, the antitoxins work immediately and provide short-term immunity. So the standard treatment, of course, would be to give the antitoxin and to give penicillin. Additional treatments, again, they're the things we give animals that we think they're gonna die. Same things we get in the hospital when we're not sure what's wrong with us. Electrolytes, anti-inflammatory drugs, thiamine, which is B1, probiotics, IV fluids, all those kind of supportive therapies that are somewhat generic. The more important issue if you losing more than one animal is to have a concern about kind of the whole group. Are you currently at a risk for an outbreak? And if you are, again, the first step is usually to give the antitoxin to get you through that risk period, increasing the forage in the diet, having antibiotics in the feed in the face of an outbreak may also help. Entertoxemia is prevented with good management and also with vaccination. Management, the same thing I keep saying over and over again, and that's gradual feed changes. Gradual, gradual, gradual. Never sudden feed changes. Again, not just forage to grain, but just, you know, differences in the quality or digestibility of feed. To prevent it in bottle babies or orphans, you want a steady intake of milk. Ideally, you want to feed cold milk so they don't overeat. Keep that crete filled. I've crossed out, let crete feed run out. Do not let that crete feed run out. Keep it full. Feed additives, this is primarily putting an antibiotic in the feed or the creep ration or the feeding ration. It can help to prevent problems. And then, again, limiting access, not, you know, don't all of a sudden turn them out to a lush pasture. Vaccination, if there's one vaccine I recommend for most producers, it would be C, D, and T, with the C and D being Entertoxemia. Fairly inexpensive protection for a fairly common problem with sheep and goats. No, cold milk is not a problem. So, it's not just about vaccinating, it's also about doing it at the right time. The most important C, D, and T vaccine is to give to the dam before she gives birth. At least 2 weeks away from birth to give time for the immunity to develop, but somewhere between 6 and 2 weeks prior to lambing and kidding, you should vaccinate the mom. The toxoid, I believe it's 2 mils, subcutaneous. If the ewe or doe has never been vaccinated, or you don't know, she should receive 2 vaccinations 4 weeks apart prior to lambing and kidding, at least 2 weeks out. When that lamb and kid is born, if it consumes an adequate amount of colostrum, it's going to be protected for it's going to be protected for at least 6 weeks. After 6 weeks, that immunity starts to decline. So it's recommended that you then vaccinate the lambs and the kids when they're about 6 to 8 weeks of age and then about 10 to 12 weeks of age. You should make sure you do all the adults on the farm. Don't forget the males, whether it's a wether or a buck or a ram, they should be vaccinated annually. And for some farms, if it's a risk, if it's something that's a problem, more frequent vaccination could be advocated. The vaccine, I'm told, is not as effective in goats as it is in sheep. Again, the immunity doesn't last 12 months when you give it. It's given at a time to protect them during their risk period. Okay, milk fever. Milk fever is, it's not a fever. It's basically a low level of calcium in the blood, and it's caused by an inefficient intake or absorption of calcium to meet either their fetal, late gestation, or lactation demands. We can have it before they lamb or kid or after. In a non-dairy animal, a sheep or goat that you raise for meat or fiber, it's more likely to occur before lambing and kidding, more likely to be caused by an inadequate intake. Dairy, because they're a high milk producing animal, milk fever is actually more likely to occur after, and very often it's kind of a little bit more particular. You can actually feed them too much calcium, and it's not that, and their problem is they can't mobilize it from their bones. So the risk factors are both too much calcium and not enough. I can honestly say for most producers, again, the problem is going to be a diet that doesn't have enough calcium in it. If you feed a grass hay all the way through late pregnancy and don't feed grain or don't feed grain with enough calcium in it, you're at risk for milk fever. Just because you have free choice minerals does not mean that the female is going to consume what she needs. Again, being a high producing female, because she has a higher need for calcium, either in her feed or to mobilize it from her own system, she's going to be at higher risk. And again, that's why our dairy females, it's probably more of a problem in our dairy females and very often occurs after lambing and kidding. And then a lot of times some of these things, all they need is a stress. They're kind of like on the edge, and then somehow you stress them or handle them or say dogs frighten them, those can put them over the edge. The symptoms that you're going to see, I cross out the word fever because it's technically not a fever. The symptoms tend to be sudden. They tend to be somewhat nervous system related, kind of a lack of coordination. She's hyperactive. They very often, this ewe is not showing it, but they often have their legs splayed out, rear legs kind of like a frog. Eventually they will go down. They will not get up like this ewe. Left untreated, or if the treatment's unsuccessful, basically they're going to go into a coma and die. The clinical signs are very similar to pregnancy toxemia, which we're going to talk about a little bit later. And a lot of times the only way you know the difference, know what the diagnosis is by how they respond to the treatment. Milk fever, they get calcium. Pregnancy toxemia, they get glucose. I think there's a little more nervous system symptoms in milk fever. I've only ever had milk fever once with this ewe, and it's been years since I've had pregnancy toxemia, but I think there was a little more nervous system, unsteadiness. At least that was my experience. So the treatment obviously is calcium. And depending on kind of how soon you diagnose the problem or how serious the problem is, kind of how you get that calcium into them. If they're fairly early stage, then you can give calcium orally. If they're kind of farther along, you can give it under the skin. If they're very serious and they need that calcium pretty immediately or they're going to die, and that's where we would administer it via an IV. Again, that might be something you bring a veterinarian in for, or it might be something that you feel confident doing. The other treatments, sometimes a ewe that has milk fever is also marginal pregnancy toxemia, so a lot of times we'll give some of the same things. B-complex vitamins basically to stimulate appetite because she's gone off feed magnesium. Sometimes they're deficient in magnesium as well. Sometimes all the things kind of come together. Prevention, it's about feeding a balanced diet, proper levels of calcium, particularly in the late gestation diet, but really we need to meet these animals' requirements on a year-round basis, understanding that late gestation and lactation are the most important and the highest needs for nutrients, but we need to meet their requirements. And that's kind of about to last week, balancing a ration. We can do things in generalities. We can understand that grain has very little calcium in it, alfalfa hay has more. We can rationalize some generalities and in most cases meet their needs, but sometimes it's worth the effort to actually look at the ration and make sure it's meeting their requirements. So if your diet is insufficient in calcium, you can add limestone to the grain portion of the diet. Limestone is the best source of calcium. It's about 34% calcium. Feed her better quality hay. Again, an alfalfa or clover hay is going to be higher in calcium than grass hay and higher than grain. You don't want to feed alfalfa, though, or your best quality hay, because you run into some risk of overfeeding it. And again, there can be some difficulty. There's adequate calcium in the diet, but she simply can't mobilize it. So it's not a thing of more is better. It's calcium is a thing of you meet the requirements. You meet the requirements. Can you feed too much calcium? Sheep have a fairly high tolerance for calcium, but again, it's going to put you at risk for milk fever. In the case of like a male, you can get kidney stones that are out of calcium salts instead of phosphorus, and we'll talk about that. Again, stress can push these animals over the edge to what might be a marginal condition into disease. I'm going to talk a little bit about poisonings, and unfortunately I have to be extremely generic in this issue because kind of there's a lot of different things that can be toxic and that can cause a poisoning. Plants in general, toxic plants, but also ones that accumulate nitrates, ones that accumulate cyanide, feeding too much urea, which is a non-protein nitrogen, molds and mycotoxins primarily in the grains. All of these things can be potential problems. Sometimes low level and we wouldn't know about them, and sometimes we can suffer death losses. Things that put us in high risk for some of these poisonings, certainly droughts. Under drought conditions, we can get a lot more problems with mycotoxins in the grain that we buy, particularly if you're buying the actual grain and not, say, a bag feed. Frost changes forages and can be problematic. Just generally speaking, not doing a good job managing your pastures, whether that's controlling poisonous plants or good fertility, whatever you want to call it. Stressed plants can be more of a problem. Sometimes, obviously, accidental exposure, and here we might not mean plants so much as, eating the battery fluid or something like that, or getting loose and eating ornamentals around the house. Unfortunately, sometimes those things happen. Again, there can be mixing errors in feed, in terms of mold and things like that, or contaminated feed. So a lot of different things that could be a risk factor, and a lot of them are hard to control. The symptoms, a lot of times it's just like the picture you see on the left, it's just dead, because the symptoms are going to vary with the toxin, and like a lot of the diseases we talked about, they can be very nonspecific. They can come on suddenly, or it can be an accumulation kind of thing. We can find them dead. Sometimes we'll see a lot of salivation, difficulty breathing, a general discomfort. Some things can cause neurological symptoms. Some things can cause them to be more sensitive to the light. Reproductive problems, which again, those are hard to put our finger on. There's often been speculation that endophyte infected fescue potentially had some reproductive effects on goats, but we really don't know, and that's the problem. And actually, fescue fits right in with these poisonings. It's not necessarily going to kill them, but what effect might it have on some of these things? It's really hard for us to tell. Treatment, again, I'm being very vague because unless you know what the problem is, it's very difficult to be able to treat it. Usually, as with most things, we are dealing with a situation where all we can do is treat symptoms. The animal is scouring, I treat it accordingly. And then the reality is many poisonings would have no effective treatment. They're going to die no matter what. Activated charcoal, something often used because it binds to toxins. Is it going to be effective for what your problem is? You don't know. If you do know what the source, obviously you would want to remove it. The best prevention is simply being a good manager in terms of your pasture and grazing. If you know plants are toxic, if you know you're at a risk for mycotoxins in the feed, you can have that tested. Generally speaking, animals generally know not to eat poisonous plants. If you look up on the internet and look up poisonous plants, you'd be amazed how many things could potentially be poisonous to sheep and goats. But so much of plant poisons depend on the part of the plant, the time of the year, the amount of consumption, and it's only situations like where we force them to eat what they don't want to eat, or the drought makes less things available that it can be a problem. And somebody was asking a question about wilted cherry that I think Jeff is answering. It's only the wilted leaves that are a problem. And so whether you remove the entire trees, I think gets to your own tolerance for risk. I think poisonous stuff gets probably blamed a lot more than it should because it's simply we don't know what happened to them, and that certainly always is a possibility. But this is a tough one because they're very generic. Polio and cephalalacia is almost kind of the opposite in that the symptoms are fairly specific. And they could come over time and actually be somewhat subclinical, or they can be more sudden, and you need to deal with the symptoms. It is a metabolic disease, but it presents with neurological symptoms, and it's basically a caused by a deficiency of thiamine. And if you recall, the rumen makes all the B vitamins, including thiamine. So it's something in the diet that kind of messes up that thiamine metabolism. And just like some of the other diseases we've talked about, a sudden change in the diet, particularly going to a more digestible diet, can increase the probability of thiamine. It's most commonly associated with high grain diets, a high sulfur intake. Distillers grains have a fairly high level of sulfur, so if they were part of the feeding program, this would be something that you'd want to make sure that you addressed. There is some evidence to suggest that the use of chorid or amprolium, which is used to treat coccidiosis or prevent it in the water, it's not like a one-time treatment is going to be a problem, but if you used it excessively and you combined its use with maybe some other risk factors, that you might have some incidences of polio. And there are plants that they can consume that can affect the metabolism of thiamine. In fact, one of them I always remember is bracken fern. So polio we primarily associate with concentrate rations, but it can occur on pasture. The clinical signs, again, they're primarily neurological. Some of them are generic in that the animal will isolate itself and he's rather depressed and he doesn't want to eat, may have diarrhea. But then we kind of move into much clearer neurological symptoms, the lack of coordination, the staggering, and the pinpoint one on this is blindness. And actually what they call stargazing, kind of what you see in the picture. Actually, both of them kind of have their heads in the air and they're kind of looking up. Left untreated, again, they're going to become recumbent. They're going to go down and they're going to die. Now, there are a lot of neurological, or an assortment of neurological diseases that present similar symptoms. Listeriosis is probably the primary one. Circling disease presents some of the same symptoms, and that blindness is really the telltale sign. Tetanus also presents kind of it's a stiffness, but it has some similar symptoms. The treatment for polio is pretty easy. It's thiamine. It's thiamine. And thiamine, you cannot purchase that from a feed store or from the internet. You have to go through a veterinarian. It is a prescription drug. It is possible to treat with B-complex vitamins, which you can get over the counter, but they contain less thiamine than the pure thiamine, so you're going to have to give more of it. So you're going to have to make sure you get the doses correct, and really either way you should work with a veterinarian. If you recognize it fairly early, a lot of times you only need to give subcutaneous or intramuscular injection. In more severe cases, that first injection should be in an IV. Again, you may want to have a veterinarian do that, and there may be a need for repeated injections. There's certain diseases, milk fever, pregnancy toxemia, and polio. When you give them the correct treatment, they really do respond quickly. You feel like you're an expert or miracle worker how quickly the proper treatment can do for them. Again, in more seriously affected animals, we may look at some of the other treatments we talked about in other diseases, anti-inflammatory drugs, because they got swelling around the brain, and also fluid therapy, electrolytes, lactated ringers, that kind of thing. The prevention of this, it's, sometimes it occurs and you really don't know what you're doing wrong. But on the other hand, I think most people who do a fairly decent job managing their animals may never have seen polio. Again, some adequate roughage in the diet. Sulfur is going to be pretty key here. Not having a diet that's excess in sulfur. If your particular situation, you were to determine that you were a very high risk because of various circumstances, you could supplement thiamine in the diet. But normally thiamine is produced in adequate quantities by the rumen. Pregnancy toxemia, probably the most significant metabolic disease that we have. And fairly common, and particularly with new producers, but even with experienced producers it can occur, because feed situations can fluctuate the quality of pasture, the quality of hay, and things like that. Where milk fever is low blood calcium, pregnancy toxemia is low blood sugar, commonly called ketosis, also called fatty liver disease because of what the liver looks like. It's essentially an energy imbalance, and what happens is the fetus places tremendous demands on the pregnant female, and if she's not getting enough energy in her diet, she breaks down that energy off her back, which produces toxic ketone bodies which overwhelm the liver. The risk factor, or the real cause, is not enough energy in the diet in late gestation, or she's not consuming enough. This could be because your forage is low quality. It could be because overall there's a lack of energy in the diet, whether it's the poor quality forage or simply not enough of a concentrated source of energy. It could be, again, a variable feed intake. She's got less rumen capacity because she's full of babies, she's eating a lot of forage, and we're asking her to eat more. A lack of feeder space, and I think this is something you really need to pay attention with goats because they're a little bit more dominating than sheep. If you don't have enough feeder space, those same animals, maybe they're younger, maybe they're older, maybe they're just timid, aren't necessarily going to get their fair share of feed, particularly grain, but also hay. Pregnancy toxemia is definitely most common in females that are carrying multiple births. It was commonly called twin lamb disease in sheep. Very rare that it would occur in a female carrying a single. Most common in ewes at one end of the spectrum or the other, a very fat ewe or a very thin ewe. If a ewe is too fat or too thin, late gestation is not the time to correct it. You don't feed a fat ewe less. She still needs to meet her nutritional requirements for those fetuses. You don't feed a thin ewe more because then you'll get the lambs too big. Some speculation that exercise also plays a role in some of these diseases. I don't think there's any research that would support that, but certainly a lot of belief that exercise is very important for the pregnant female. The clinical signs are somewhat similar to, again, to the milk fever. First thing she's going to do is separate herself out. She's going to be slower getting to the feed bunk. She's not going to be hungry. She's going to act depressed. She's going to develop possibly some nervous signs. She's not going to be real steady. She's going to be wobbly. Eventually she's going to go down, and if left untreated, she's going to die. Some people can detect a sweet acetone smell on her breath. You can use the little sticks to see if there's ketones in the urine or blood. There are tests for that. Again, it's going to look similar to milk fever, and the way you're going to tell the difference, actually two ways. I mean, you can look at what you're feeding, and you should be able to determine if there's likely a deficiency in energy or calcium or both, but also, again, the response to treatment. You know, when a ewe has milk fever, believe me, she will respond very quickly to calcium. And she does a pretty good job responding to pregnancy toxemia once you get some glucose in her as well. Treatment, the first treatment could be simply get rid of the problem. The problem are them little boogers inside of her. Get those little babies out, and she no longer has a drain on her system. So if you're far enough along and you have a kind of a due date, you're fairly confident, you can induce labor with steroids. You're going to need a veterinary prescription to do that. You can do a C-section. Again, you're going to need a veterinarian to do that. On valuable animals, I think it can certainly pay. You know, once those offspring are delivered, she no longer has the problem that's putting that strain on her system. But more often than not, we are able, or hopefully we can intervene early enough that we don't have to go to that extent. When you catch them early enough, you simply need to give them oral glucose. The most common treatment is propylene glycol. Very often its trade name is ketosis cure. You can find it in any sheep or goat supply store, dairy store, whatever. Some alternatives, not as good, but still are getting a source of energy in it, or caro syrup, molasses, that kind of thing. When they're a little bit more advanced, giving the glucose under the skin is going to get it in quicker. And of course, when they're most advanced of all, you need to get that glucose in through an IV. A lot of times, as with milk fever, they may also be deficient in calcium. They may need supportive therapy like electrolytes, lactated ringers, sodium bicarbonate, that kind of thing. You know, a lot of these are fairly common treatments as we get advanced cases of diseases. Pregnancy toxemia is prevented in the way that we feed, making sure they have adequate energy in their diet. Typically this requires some concentrates, particularly if they're carrying multiple births. Better quality forage also plays a role because there can be a difference in the digestibility of different quality forages. Most hays should be up around 55, 56, 58%. If you feed a hay that's down below 50%, they're going to be getting less energy, and so that could push them into an energy deficient state. And that's why concentrates are the cheapest, quickest, and easiest way to make sure they're getting enough energy. If you have a lot of sheep or can justify it, if you can figure out who's carrying those multiple births, separate them and feed them more, that can also help. Since really fat and really thin ewes are very most susceptible, if you can keep these animals in moderate body condition score them, and try to avoid having animals that are too fat or too thin. And I know sometimes that can be a challenge. You know, some females, no matter what you feed them, they seem to get fat, and vice versa. We really want to avoid any kind of stress during this last 4 to 6 weeks of pregnancy, because again, a lot of times it's all they need to push them from a marginal situation to a disease situation. Adequate feeder space. When you feed grain, when you feed hay, make sure everybody gets their fair share. You know, sometimes they need more space than the book says. Make sure they can all get enough to eat. It's one of the reasons I advocate not keeping young pregnant females with the mature females. They have a difficult time competing. Scours or diarrhea is not so much a disease but a symptom, but it is probably the most common metabolic dysfunction that we see. And there's a lot of causes of it. You know, think of all the things that can give you the runs. The causes are both infectious and non-infectious. This next slide just basically tells you the different sources of infectious versus non-infectious, and there's just lots of stuff that can cause scours. Again, it's not primarily what's wrong with the animal. It's very often a symptom of some other issues. The symptoms, obviously, we all know what diarrhea looks like, but if you consider the definition, they're going to the bathroom more often, they're producing more quantity, and it's more fluid. Sometimes there's mucus or blood in it. Sometimes that's the only symptom they have. Look at the goats in this picture. This was in our goat test. Most of them, about a third of them, broke with scours after they were put on test in the first 2 weeks. But it had no health effect on them. It was just kind of an adjustment to the diet. Ones that need treatment, we're usually going to see some other symptoms, dehydration being the most important one, particularly on a very young animal. Obviously, anything that looks dirty at that back end is indicative of either a current or previous scouring issue. If it's really having an effect on their health, we're going to see it evidenced in a poor quality hair coat, just a general unthrift and a poor performance. And that's why I can say with confidence these goats actually weren't affected. They look nasty, but it actually wasn't a problem for them. What you treat them for is kind of like those poisons to some degree. You got to know the cause. And I say the age of animal only that young animal I think you need to pay a lot more attention to. Most adults that get diarrhea, in a lot of cases it's a self-limiting thing and it's going to go away on its own. I don't tend to make that assumption with a young animal. If it's a non-infectious cause of diarrhea, something like just a simple indigestion, the first one is just the fancy name for Pepto-Bismol, or in the picture it's a generic one on the right. The second one's just kaopectate. I've got a line drawn through Imodium AD because I wouldn't recommend that be used. That basically paralyzes the gut, and that's not really what you want to do. Probiotics can be useful for treating scours since they put healthy bacteria into the rumen. If the animal's dehydrated, and again that's most likely to be on a very young animal, we need to get fluids in them. We need electrolytes. We need to replace that fluid that they're losing. If it's an infectious cause of diarrhea, this is really the only place that antibiotics come into play. If you simply see an animal with diarrhea, there is no reason to get out the antibiotics or the dewormer. There really isn't. But there are causes, infectious causes, that will respond to antibiotics. The drug of choice tends to be spectinomycin, particularly for young lambs and kids. It treats E. coli scours, for example. Cord and the sulfa drugs, of course, are the prescription treatment for coccidia, and coccidiosis is a very common cause of scours in our young animals. Preventing scours, you can't totally prevent them anymore. We can totally prevent them in ourselves, but again, it gets back to those gradual changes in diet, making sure you have roughage in the diet. Good sanitation is real important for preventing scours, and then in the case of coccidia, the use of coccidiostats can help prevent outbreaks. I apologize for going over time tonight. I guess I had a lot of diseases I wanted to cover because I've still got just a couple more. Urinary calculi is a very important disease and a very common one, particularly with people with pet goats and pet sheep. And basically it's kidney stones. You get a stone that lodges in the urinary tract of a male animal predominantly, and he's not able to pee. Those stones are usually composed of phosphate salts, but they can be composed of calcium. Primarily affects a wether, and there is certainly a contribution of if you castrate an animal very young, which is when you should do it, their urethra doesn't grow as much, and so you increase the risk of urinary calculi. But you only increase that risk as if you also add all these other risk factors. It does sometimes occur in an intact male, but not nearly as often, and it would be very rare in females. It's primarily caused by an imbalance of calcium and phosphorus in the diet. That ratio, if you're feeding males, should be 2 to 1. People often ask or that think that all animals need 2 to 1. Actually, if you look at the nutrient requirements for pregnant and lactating females, that calcium is much higher, and it's not actually a 2 to 1. In some cases, it's not that much higher than a 1 to 1. But in that male, because of the risk of urinary calculi, we need to keep that ratio up around 2 to 1. So primarily it's caused by a diet that has too much phosphorus in it. Basically, again, a high grain, because corn, barley, soybean meal, they're all very high in phosphorus and low in calcium. And then a low roughage diet. Not only does the roughage have more calcium, but also causes them to salivate more, that has a role in getting rid of some of that phosphorus. We can also get calcium stones by excessive calcium intake, and we primarily associate that with, say, having feeding all alfalfa to a group of males. That's putting them at risk for urinary calculi, not to mention that kind of feed would never be necessary for them. And water is also an issue. If it's not good quality water, if they don't drink enough water, that's also going to have a role in the makeup of that urine. The clinical signs, some of them are generic. Again, they're uncomfortable, they isolate themselves, they're restless, they don't feel good, they have pain. But where you're going to differentiate it is when you look at that sheath of that animal, you may see some urine kind of dribbling. I actually don't have it here, but they're going to have difficulty in urinating. That's certainly a symptom. Eventually, as that pressure builds up, they may have a humped up appearance. You may see a distended abdomen like you see in the picture in the top. Left untreated, that bladder is going to rupture and it's going to kill them, left untreated. If you catch the signs very early, you can actually drench them with ammonium chloride, which will acidify the urine. You can get that at most any place that sells sheep and goat supplies. If you catch them early and the location of the stone is in the urethral process, you can actually just snip that off. If the symptoms are much more advanced, you're either going to require a surgical intervention, which is going to be expensive, may or may not have a positive income, or you're going to humanely euthanize that animal. So this is clearly a disease that we want to prevent, because once they get the symptoms very far along, the results of treatment are not necessarily very good. Again, to reiterate that ratio should be 2 to 1 when we're feeding lambs and kids and males. We don't ever want to feed a straight alfalfa diet to our bucks or rams or wethers. The addition of ammonium chloride to the diet helps to acidify that urine and helps to prevent urinary calculi. It's a common component of most lamb and meat goat rations. Having salt out there will encourage them to drink more water. And again, water is very important. Forage in the diet. We should never feed sheep and goats without some forage in the diet or some roughage in the diet. Vitamin A has been implicated as well, making sure there's adequate vitamin A in the diet. I got at the bottom delay castration, a question mark and a line drawn through it. You certainly will read things on the internet that advise you to delay castration. I don't agree with this because it is not a single cause of urinary calculi. It's only a problem if you don't properly feed your animals and do all these other things that are important. And from a welfare standpoint, castration should occur at a very young age. If you do delay castration to several months, if it's a pet, you should take it to the veterinarian to have it done. White muscle disease is the last one I'm going to talk about tonight. Basically, it's a degeneration of the skeletal or cardiac muscles caused by a deficiency of selenium and or vitamin E. We actually usually don't know which one, and we usually treat with both. They can be born with it or they can acquire it. It can affect their cardiac or their heart muscle, or it can affect their other muscles. There's a map that shows the selenium status in different parts of the country. For those of you in Maryland, well, you can see in the Northeast we are completely in selenium deficient areas. And of course the risk factors are a dietary deficiency of selenium or vitamin E. Selenium, if the soils are deficient, the plants are going to be deficient, and therefore the grazing and the hay and everything else that we feed to them is going to be deficient. Vitamin E is primarily, we get that from hays, particularly legume hays, and from grazing. So if you feed a poor quality hay, you don't give them access to pasture, you're going to put them at risk for not having enough vitamin vitamin E. There's a couple of pictures of what young lambs might look like. The cardiac form of white muscle disease, and I'm not certain I've ever seen it, the symptoms they say would be very similar to pneumonia, and obviously then you'd have symptoms that affect the respiratory system and the heart. There's a picture of what a heart would look like. Normally these animals are just going to die, and I supposed if you saved them they would fail to thrive. So if they didn't die, you kind of would wish they died. The more common form of white muscle disease affects the skeletal muscles, and if you look at that picture in the lower right, the white, you basically get a pretty extreme case there where the muscle's like all white, and that's what you would see if you cut the animal open. They're stiff, they're weak, they're in pain, they may stand with their back arched like you see in these pictures. They're not able, they're not able to move around, that sort of thing. Can obviously resemble potentially other diseases, perhaps tetanus or something like that. As far as treatment, again, the cardiac version is going to be largely ineffective to treat that. They're just going to die or fail to thrive. In the skeletal form, we're going to treat with supplemental selenium or vitamin E, which is the product called Bosi. That's the treatment for that. How do we prevent it? Like every disease we've talked about, it's about good nutrition, it's about feeding balanced rations, it's about feeding good quality forages, it's about providing access to pasture. Free choice minerals are kind of a catch-all. It's like we do everything right, and just in case we got those free choice minerals out there. It's kind of like us taking vitamins. We like to think we're consuming a diet that's adequate in the things we need. But we take a vitamin kind of just in case. Selenium is a controlled element because it has been shown to be carcinogenic. So we just can't feed all the selenium we want. There are actually rules in place. And the 0.1 to 0.3 parts per million in the total diet are not to exceed 7 milligrams per head per day. Those are the actual requirements. You could very easily have just one lamb with white muscle disease. I think in most cases with diseases, I think the more cases you have is when you think you have more of a problem. If I have one, I'm still going to consider that I have a problem, and I'm going to look at the whole situation. But it is possible just to have one. I'm not aware of a genetic susceptibility to it. There are, obviously, to prevent white muscle disease, if you're in a selenium deficient area, definitely we got to supplement it. And in an ideal situation, we supplement it in the feed and minerals. And in most cases, I'm going to say 9 times out of 10, that's going to be sufficient. There are oral products that you can give, like gels and things like that, and there are also the injection, which I'm going to talk about in a little more detail in another slide or two. Now, white muscle disease is a clear indication of a selenium deficiency. But selenium is associated with so many other things. And our problem is, if you look at this list of symptoms, they are all incredibly generic. Increased mortality. You had too many lambs or kids die. You can't assume it's a selenium deficiency. It's more complex than that. So it makes it really hard to diagnose a selenium problem. And so if I had even a single case of white muscle disease, I would probably want to investigate. And I may even make sure I either cut that lamb open or have an autopsy to confirm that that's a white muscle disease. If no more lambs had it, I'd feel pretty good. But it would certainly be a reason to suspect maybe there's some other problems, because these by themselves is going to be very difficult to pin on selenium. Okay, the last thing I want to talk about is, because we're on selenium, is the use of the injections. And I just want to go over a few things with this. The first thing, of course, is that it is prescription only, and if you actually read the label, it's labeled for lambs that are over 2 weeks of age, and it's labeled for non-pregnant females. The company actually lists on the label that do not use it on pregnant ewes. Of course, it's not approved for goats, but you still need a prescription anyhow, so that part doesn't really matter. The reason it's not approved for sheep or for pregnant females is because it has caused abortions. Does it mean every animal that gets an injection, or even any, are going to get an abortion? Probably not, but it has caused them, so the company removed pregnant ewes from the label. It's also not approved for lambs and kids under 2 weeks of age. And I know that most people who use Bosi actually do the two groups that it's not approved for. They do pregnant females, and they also do the babies right after they're born. And the only thing I would advise here is and you got to be working with a veterinarian anyhow to get the product, but be working with your veterinarian as you make those decisions. The other thing I will say is if you don't need to give the injections, don't. It's not like vaccinating for CD and T. It's not a recommendation like a vaccine. You do it because you need it, because you've identified a problem. Otherwise, it's far better to supplement it through the feed. And sometimes supplementing it through the feed means that it has to be in that grain ration and that has to be force-fed. Free choice minerals may not be adequate. But that's always preferable to giving the injections, because one of the problems with the injections is it's kind of like copper. They're very narrow range between what they need and what's too much, so it can be very toxic. There are other products besides BOCI, so you got to make sure you use the right product. You got to make sure you give the right dosage. So really work with a veterinarian. And if you think you have a selenium problem, you had a lamb with white muscle disease, or maybe just things aren't going right, and that's one of the things you want to look at. There are testing that we can do that you can do to help see if it's a potential problem, whether it's autopsies, blood tests, or if you do supplement with selenium and have some way to measure the response to that. That's what I would recommend. I just wouldn't automatically give injections. I would make sure they're based on sound knowledge. Last slide, I promised, and then the one with the last picture. And again, I apologize for going over time, but if I had to summarize how we prevent problems, we've been talking about all these things the whole time, and that's feed a balanced ration. Again, generalities, knowing basic information about feedstuffs and requirements works 9 times out of 10, but sometimes you need to look and actually see if that ration's meeting their needs. Sometimes you actually need to measure and see how much hay they're eating. Sometimes you actually need to get that hay tested. Sometimes the general things aren't good enough. Life cycle feeding, making sure you change feed as her life cycle changes, as she's, as you're breeding her, as she's in the early part of pregnancy, late gestation, lactation, drying off period, all of that. Make sure you change your feed. Same thing with the youngsters. Their nutrition is going to change as they grow and get older. Don't make it complicated. Don't make it complicated. Rations don't need to be complicated. Remember, the reason that a bagged feed has so many ingredients in it is because they're trying to put the least cost feeds in there, and they have access to a lot of different kinds of feeds. Simple. The most basic requirements are energy, protein, calcium, and phosphorus. Don't even look at selenium and copper until you make sure you're meeting the needs of our most important nutrients. We've said over and over again, gradual feed changes. It can never be too gradual. Never. Make the changes slow, not just with grain and forage, but different kinds of forage. Okay, adequate roughage. They're ruminants. You can feed higher concentrate diets, you can feed more byproducts, but they should have some roughage in the diet. I'm particularly critical sometimes of the 4-H program because they teach these kids to feed so much grain. I don't have a problem with feeding grain, but they still need to have forage in their diet. I'm stubborn. I superintended in the Maryland State Fair and the Goat Show, and I refuse to bed those pens with sawdust or shavings. I still put straw in the pens. At least that gives them some roughage. Do regular body condition scoring. Again, what condition they are can have a big effect on their susceptibility to these diseases, particularly pregnancy toxemia. Aim to keep animals in that middle part, 2 to 4. Try to not keep 1s and 5s. And just common sense things, exercise, sunlight. Sunlight's where they get vitamin D. It's not just being nice to them, it's important. Being outside, and eating and grazing is where they get a lot of vitamin E. Exercise is important. Those are just common sense kind of things. And that concludes our series and tonight's presentation. Again, I apologize for going 25 minutes over time, but I guess wanted to cover all these diseases. Question about selenium.